Hi, I'm Ann Peterson. Welcome to Health Perspective by Blue KC, featuring advice from experts on a variety of health topics. It's the place where you'll get the direction you need to make good health choices. Today, Dr. Jennifer Klemp is here to talk with us about breast cancer. Dr. Klemp specializes in breast cancer prevention and survivorship, and she has been practicing for 13 years at KU Medical Center. Thanks for joining us today, Dr. Klemp.
Thanks, Ann.
Most of us have a family member or a friend who has been dealing with breast cancer. 1 in 8 women are dealing with breast cancer in their lifetime, and next to lung cancer, it's the leading cause of cancer death in women. And since October is Breast Cancer Awareness Month, this is really a good time to share important information on this topic. Are we seeing an increase or a decrease in breast cancer?
That's a really good question. And I think one of the things that's happened over the past few years is we're actually seeing a slight decrease in overall breast cancer incidence. One of the reasons for that is early detection. So although we're seeing a decrease in invasive breast cancers, we are seeing an increase in what are called non-invasive breast cancers, or things called ductal carcinoma in situ. We can only find them on mammography, and it's with that annual mammogram that we're able to find those early onset breast cancers that have almost 100% survival.
What are the symptoms of breast cancer?
You know, some women complain of nothing. So it's a matter of something came up on a mammogram, they follow up on it, and then we find that there is a breast cancer. Other women do sort of have insight, and I think that we see that more times than not, that women know there's something wrong and they sort of follow up on that women's intuition. Some women do complain of pain, and that can be associated with maybe there's an area that has grown to the point where it's pushing against the nerve endings. But for most patients, there isn't sort of a pain or a symptom that goes along with the breast cancer. There is a lump for a lot of women, and that's why that breast self-exam can be very useful.
What should you be feeling for when you are doing that self-breast exam? That would be a red light that you might be at risk of breast cancer.
Well, first, if a woman's postmenopausal, she should just set a date. So the first of the month or whatever her time is that she'll remember that to do her breast self-exam. But for premenopausal women, it really needs to be the week after a cycle is completed. And the reason for that is the breast changes throughout the month, and we'll have patients who do breast exams every day, and they'll come in with something that they find. So the key is doing it consistently, but at the right time. Then the second thing you want to look for are things that feel different than the normal architecture of your breast, which is why it's important to do regular breast exams, because then you know what your architecture feels like, because fibrocystic changes feel different than something that would be more suspicious. And something more suspicious usually is firm. It usually doesn't move. It's more fixed. Cysts in the breast tend to sort of jump around, and if you push on them, they'll jump away from you, whereas things that are more suspicious or fibroadenomas tend to stay put. So firm, fixed, and things that are different than your normal architecture.
When should you begin mammograms?
That's a question that's independent to the person. So for instance, if a woman has a family history, we're going to determine her onset of a mammography based on what the ages of breast cancer were in her family and what her other risk factors are. The average woman could have a baseline at 35 and annual mammography by age 40, but I think there's some nice legislation by the Florida senator, hopefully getting that age earlier. We are seeing a trend nationally that women are being diagnosed younger. So I think for certain women in particular, whether it's dense breasts or family history or other risk factors, starting them earlier is sort of a natural progression that we're seeing.
And what role does family history play in this?
There's really 3 categories of risk. There's sort of that sporadic breast cancer that occurs, age, lifestyle, exposures. There's familial cancer where it feels suspicious, it looks suspicious, but we can't prove it with a genetic test. And then there's actually the smallest subset who have the highest risk, which are the genetic mutation carriers.
Well, if you have a family history of breast cancer, what should you do? How can you be proactive in your breast health?
So first is getting a good family history. Sometimes that's not possible. Sometimes patients have what's called a limited family structure. You don't have enough players on the field. Maybe dad was an only child and mom had a brother. So we don't always have a clear picture, but first starting out with who had cancer, how many people were in the family, and then determining based on those factors, when should you start imaging? And basically mammography is started 10 years prior to the youngest affected relative. So for some women that may be 25, 26, 35, and then for the average woman it's really 35 to 40 at this point.
How does exercise lower your risk for breast cancer?
I think the greatest thing that has come out about exercise and breast cancer has to do with the fact that as we age and as we go through menopause, we still need estrogen. And even though our ovaries don't produce estrogen, something else needs to produce it. And unfortunately, that is fat. So if fat is producing estrogen and we want to keep that estrogen level down, one of the natural ways to do that is to reduce our overall percent body fat. So that's one reason that not only exercise is important, but getting in that resistance training so we can convert fat to lean muscle.
Thanks, Dr. Klemp. And thanks for joining us today for Health Perspective. For more information on breast cancer, visit the Education Center at bluekc.com. Be sure to come back next month for tips on another health topic. And register on bluekc.com today to put yourself on the path to better health.